I was interested for myself, to see what it was like in Africa and what healthcare was like, because I know what it is in America, and I really wanted to, do primary care clinics, and yeah.
I'm volunteering because I want to help others. I wanted to get out of my comfort zone and do something different. And I thought that this was a great opportunity to do so.
There are lots of reasons that I'm volunteering, but really I just wanted to donate the time that I have, because I have a lot of off time as a travel nurse. I'm able to take off a month in between assignments to help people in need. And yeah, that's why I'm here.
I am volunteering for Gold Coast Foundation because, well, first of all, I met Kwaku in the Dominican Republic when I was doing another medical missionary trip. But why am I volunteering through medical missions? It's because it's been something I wanted to do since I was a little kid. Ever since I saw these two missionaries that came to my church, and I saw that I could use my talent and something that I enjoy doing very much to help people. I was all for it ever since I was about 13 years old.
I'm volunteering here on three personal reasons. First off, I believe in giving back to the community in which you were raised from, in this circumstance, your country. Secondly, I just believe in kind of like mastering your craft, and the second thing implies on working on hands-on experiences in the clinicals that we have here, and thirdly is building up my leadership skills and getting to connect with people.
Well, it has come to my notice that most of the deprived societies in Ghana lack medical attentions and lack many facilities required for them. And this opportunity came for me to help provide them with medications. Yeah.
Currently a board member and event coordinator for Gold Coast Medical Foundation. Well, first, the reason why I'm volunteering is because Gold Coast Medical Foundation is a family organization. It's basically hands-on. All family members are involved, extended family. We're all coming together to do something good for someone else besides ourselves, besides our own family members, besides just our friends. We want to do something for the community that we were raised and born in. We also want to reach out to other communities and help out. And the reason why I volunteer is because I know what people need, and I know that it's not always that they can get it. And if I am able to help in any way possible, I'm more than happy to do so. And I'm willing to go to any extent to make sure that my fellow human being is also doing good.
I think the opportunity to work with in a developing country, providing medical care to folks that probably wouldn't be able to get it any other way. And so I'm also interested in global health.
I was told about this organization through Byron Gilchrist, who was a professor of mine for health disparities, and he told me about the trip. I've never been to Africa, and I thought it'd be a new experience. As someone as me who would want to go to medical school, this would look amazing for me. And this opportunity came, and I took it. One, I've never done a global outreach program like this before, so it was something completely new to me. I wanted to experience something new. I've volunteered in the hospitals before, but I've never done something that's in a whole nother country, especially a developing country such as Ghana. And this opportunity, opened my eyes to many new things and something you can't get in a clinical setting.
My end goal for this missions trip was to gain knowledge, to gain life experience, to learn things that, I never got taught, or, to just grow as a person.
I have a friend that I used to work with who works with Kwabena, one of the co-founders of Gold Coast. And she knew that I was the kind of person that would just jump on an opportunity like this. I have a lot of or I make time. I don't necessarily have a lot of time off, but I make time to do things like this because I really enjoy traveling and I really enjoy helping people.
My end goal of the mission, and any mission in general, is just to help, is to just help the contacts, which is being Kwaku and Kwabena. If I swept floors this whole trip, I would be the best janitor in the whole world. I have no real end goal besides to just use whatever is I have at hand and to do whatever I can possible to make the lives of the people I meet just a little bit easier.
My end goal of the mission is to see the lives of the people that we touch actually to see their life kind of like, be impacted by what we did for them, by giving them, the medication that they need, also giving them the love, the smiling, in me seeing fulfillment in them also gives me kind of like a fulfillment of me actually contributing towards a greater purpose here on this earth.
My end goal for this mission is to help in my possible best, all I can, to assist in everything they do so that most of the communities will have medical assistance. Yeah. Well, my sister is a board member of Gold Coast Medical Foundation, and then she introduced me into Gold Coast Medical Foundation.
Well, I don't think there's ever going to be an end goal, which is the vision is there, and the vision is to constantly and continuously, mainly to have a healthier community. However, that's going to be something we're going to be battling for a long time. But the end goal is to be able to provide to as many people as possible the health that they need, the clothing, food, whatever assistance that we can help with that they need. And at the end of it all, just really everyone being able to live comfortably.
The end goal of the mission, to really see what we can do to improve the health conditions of the folks that live in this country. Whatever it is that we can do to be able to improve their health. Not just through medical care, but, figure out how we can improve some of the health determinants that they may be experiencing. Better food, better water, better relationships.
I cook in the kitchen. That's one of my the things that I do. I wake up early, hop in the kitchen, help Maame. She's the executive chef. She does her thing, and I'm just behind her, helping her, backing her up, making her job easier. And then alongside of that, during clinics, during a normal day, I help out with pharmacy. I've done blood pressure, all that fun stuff.
The activities I participated in, quite the range of activities that we've participated in. First and foremost, we run clinics. My specific duties this time around, we're doing consultations. So whether it just be somebody sitting down and needing assistance and trying to understand diabetes better, or trying to understand high blood pressure, or just being able to provide them with some sort of medication due to the knowledge that I've had by shadowing Kwaku and Kwabena. Next would be urine analysis. So we have a urine analysis machine, and I would help the physicians with the consultations by providing them with data, the necessary data to help them make educated consultations. And then next would be helping out with determining if somebody has high glucose or not. So we do just blood glucose testing as well.
Yeah, so far, our first clinic that we had was very huge. We had over 400 people show up, and there we were able to serve this local village, and we had that was the first ever clinic we ever had. So there we were able to have different stations whereby, I did blood glucose for the first time ever, taking blood, checking their blood sugar levels. I was able to do that. Also, I also got the chance to participate with this orphanage donations, whereby we were able to kind of connect and correlate with the kids playing soccer, playing a local game called Ampe. Also, we've had the opportunity to go see chiefs, met people, prominent people in this society, and it's just been a tremendous opportunity for me because I've been able to connect with people that I never thought of connecting with. So that's one vital thing. or there's some events that I feel like I've really enjoyed being a part of.
And the various stations, I've worked in with the registration and then testing for glucose and blood pressure. And also, because of the foreigners who came around, I had to do some translation for them from the English to the local dialect.
Well, from start to finish, my routine was a little different from everybody else, considering I am the chef and also at the same time playing event coordinator. So my day begins with making sure everyone has a good breakfast to get them started, to give them the boost and the energy that they need for the task ahead of the day. And then I join in with the team at clinics. Well, to make sure, at clinics, I'm mainly there to make sure that everyone is nourished, water, juice, sodas, whatever's needed, food, snacks. In between there somewhere, playing translator when possible, playing organizer and making sure lines are moving smoothly, everyone is organized, and there are seats for people to sit, and just making sure the clinic is running smoothly, and also making sure everyone that is volunteering is okay.
Sure, since I've been here, I got here a week after the mission started, and so I participated in 10 of the 11 medical clinics. The role that I played mostly, not played, but the role that I did mostly was helping with triage. So I did blood pressures. 1 week I did, we did the urine analysis, but for the most part I did the blood pressures. And that was pretty interesting to sort of see the different levels of blood pressures throughout the country. There are some villages where a majority of the participants had very high blood pressure levels. And the last clinic that we did, we noticed that the blood pressure was, their blood pressure was a lot lower. And so it'd be really interesting to look at that even closer, to see what are the differences between the different villages and why the blood pressure changes in the population.
I got the opportunity to work with two amazing physicians, Mawuena B.S. and Kwaku B.S. Those are the two board members and leaders of the organization. Coming together on this organization, you meet those two. I've met PAs, pharmacists, who all work in a professional field around me. And day to day, each clinic, I'm learning new things about medicine. I'm learning new things about diseases. As a recent graduate who wants to go to medical school, all this information is valuable to me. By being on this organization and helping them, showing that I'm interested in what I want to do, I'll be able to, address myself and push myself forward in a professional setting, as showing that I've worked in developed countries.
I mean, a typical clinic day, we get to clinic, we set up, we are really seeing like 400 patients a day. And the funny thing is, I feel like the first clinic we were only supposed to see 200 and we saw 400. And it was exhausting. Like I would say it was equally as exhausting as like a 12-hour shift at home. But yeah, you're just in the heat all day, giving out prescriptions, educating people, doing the best that you can for these people when you're tired and you're hot and you haven't slept at all. That's what a typical clinic day work looks like. But then we also did the cerebral palsy conference and clinic, which was educational for a lot of people that were there in the community. But we also did a clinic for the moms and the kids. Every single clinic was different, and I feel like we were able to bring something different to every single one. And every person that was here really, I think, gave everything that they had. Even, some people had a medical background and some people didn't, and I still feel like everyone was able to give something. So they arrive, we do like a form to check them in, basically all their demographic information, medical history if they take any medications, allergies to medications, if they're single, married, pregnant, breastfeeding. We have to know all that about them. And then we take a couple of their vital signs, and then I guess blood sugar if they need it, like if they're above 30 or pre-diabetic, and then they'll consult with a physician or whoever is there, and then they'll go to pharmacy if they prescribe anything. And we were doing some education too after they got their meds, and then we'd send them on their way.
Yeah, so basically a clinic is going to look like this. Anytime a patient comes to a clinic, it can be either a male or a female, or sometimes they come as a family. Most of the times it's the woman with her kids. But an example is if a person wants to come through the clinic, we're going to hand them a card. When they come with their card, let's say their card is number 6. So when the 1, 2, 3, 4, 5, 6 persons comes through, we have a registration table whereby we take their name, their age. We take any medications they are taking right now. We take the reason why they've come to the clinic. So from there they go to the triage station. The triage station, that's where they are going to get their blood pressure checked as well as their temperature checked. From there they go to the blood glucose stand. And the blood glucose, they check their blood sugar levels to see whether they are diabetic, or if already they are diabetic, we check to see whether their medication is actually helping out. Then from there, they go to the consultants, whereby the consultants tell them that, hey, this is what is really wrong with you, this is what you need to do, and they prescribe medications for them. And from there, they go to the pharmacy, whereby the pharmacy gives them the prescription of what the doctors or the consultants told them to go get, and they have like local interpreters telling them how to use the drugs, and from there they're able to move on and have a wonderful, fantastic life.
On a normal day from the start, you have to go through the registration station. From the registration, you go to triage to check your blood pressure and temperature, and then from triage you move to glucose to check for your sugar level. Yeah, then from there you move to consultation. That is to the doctors. And after that you go to pharmacy for your medications.
Well, a typical clinic day for a patient will be going through, well, most of them are getting there very early in the morning, 5 a.m., 6 a.m., 8 a.m., just to be the first or to just make sure they're seen. So a typical day at clinic for a patient would be first waiting to get a number, and then going through registration, moving on, registration with name, age, and medical history is taken, and then moving on to triage, where vitals are taken, and then moving on to consultation, where their patient gets to speak with a doctor, physician assistant, and basically consulting them through whatever problems it is that they have. And then at that stage is where the consultant will either give a prescription for whatever it is, medication they think is needed by the patient. Patient moves on to pharmacy, gets their meds. We also, at some clinics, have health talk or health outreach, where the patient will sit and have a talk with a physician or someone on the nutritional side to basically talk to them whether they have a high blood pressure, how to keep it under control, whether high cholesterol, how to keep it under control, just basic things. We've also had, psychiatrists, psychologists there to talk with them, and then they get their medication and they move on.
So the clinics get set up, and initially they'll get registered. Someone speaks to them in each town that we've visited. I've noticed that they've gotten local people to do the translation. So they'll sit with the initial person or people to do registration, where they ask for age, what their marital status, some reasons for them coming to the clinic. And right after that, they'll send them to get their blood pressure taken. If it's pretty okay, then we send them straight to consult with one of the doctors. if the blood pressure is high, or if the person reports that they've been diagnosed with diabetes, then we'll send them to the next station, which would be to get their blood levels checked, their sugar level checked, and then they see the doctor, and then a determination is made as to whether or not the person needs medication.
You have to be sure you explain to people how to take the medication, because if not, they could take it the wrong way and end up hurting themselves or doing damage to their body. So let's say, for example, somebody comes in, they give us their slip. Typically, I would look for the medication, check with the pharmacist to make sure that, all the directions are clear, all the medications are right, all the dosages are correct, and then we hand them off to people who translate into the language that they speak, and then that's pretty much it.
This time around was a little bit different than any other, medical mission trip that I've done, just because we had quite the range of people. So coming from Oral Roberts University, it's a group of people that we all have kind of the same mission and vision. And this team definitely had a different orientation in what they thought a missions trip was going to be. So that was a little bit different for me and kind of got me out of my comfort zone a little bit. So one thing that I definitely enjoyed and got a lot out of was being with people that all had different kind of ideas of what a missions trip should be or what a medical outreach should be. So I definitely enjoyed learning about people's different perspectives and backgrounds. This is not my first time doing something like this, and I thoroughly enjoyed, having something different for once.
Well, this is my first time here in Gold Coast Medical Foundation, and it's a life-changing experience I've encountered myself into. And I know it's going to really change me, my daily activities and everything I do. Well, it's going to change me with how I speak to others and how I'm willing to help others.
The last place that we visited, I think, was very difficult to get to, right? In terms of the conditions of the road, just where it is, it felt very, very rural. And so I wondered if, there is really not a whole lot of access to unhealthy foods, right? It sounds to me, or I would think, and we have no way of knowing this because we haven't really looked at the data, but is it because the folks in that part of the country really have to rely on their own land, right, in terms of to get the foods that they're eating from there? I'm imagining that they probably wouldn't have a lot of meat products that they're eating. There's a lot of activities, right, to be able to get to another part of town. I think it's a lot of walking that they need to do to be able to get there. So I guess physical activity and foods is what I'm guessing, but I have no way of knowing that.
The organization, so Gold Coast Medical Foundation, is trying to accomplish a lot of things. They're trying to not only help out the infrastructure of Ghana, being infrastructure meaning, just helping out with building buildings, or just facilities that will eventually be able to long-term help the people of Ghana, whatever region we're in, whether it be, so specifically, if you remember, we went to a hospital in the Ashanti region, which is kind of something that they're helping out. That's why we donated a lot of supplies to them to help out with just kind of, so they don't have to worry about, they can focus more on taking care of the people rather than the cost of trying to run a hospital. So the ultimate goal for Gold Coast Foundation, I would say to, just provide both short-term and long-term care for patients, and at the same time just make things a little bit easier, whether it be with donating school supplies or hygiene products.
They're trying to accomplish a lot of things, and it's really hard to pinpoint like one exact thing. I mean, they want to make the community of Ghana healthier in general, but something that I really noticed and that I really appreciated was that they took the time and they did their research to really find communities that needed us. They needed primary care. We weren't like all the time. We were going to these remote villages, and for me that was admirable because it took a lot of research to find these places, and I think that going into these small communities where these people have never had any of this before, I think that was really valuable. And as a nurse, I felt like I was able to do a lot with the clinics because I have a medical background and I know what's going on with the drugs that we're giving and, you know, why we're giving the drugs and vital signs and educating patients about health promotion.
The organization is trying to accomplish a community of healthy living. They are trying to show them that there's a way to a healthy life. There's a way for you to live life more than just wealth, but health as well as wealth. So me being a part of this organization shows that they are really concerned about the people of this community, as well as the children of the community, because the children are the next generation leaders. And so one thing I see this program really focusing on is the donations to the school. You see them really actually helping the kids, and in so doing, they are able to contribute to the good of society. So yeah.
Its goal is to partner with other people or other organizations to help them or to assist them in terms of needs and everything, helping other communities to get medical assistance. Yeah.
Well, the vision of Gold Coast Medical Foundation is to partner with others who are into the same kind of things we're interested in, which is the community first, before anything. Community health, community wellness, community comfortability for those who are in need. That is our vision. The mission is to have a healthier community. In between there, we get involved in other things such as orphanage, adoption. We've basically adopted the Westphalian Children's Home in Oyoko in the Ashanti region, which we make sure they're okay, clothing, food, school supplies, and also donating to other schools, making sure schools supplies are in place for students who don't have backpacks, pencils, notebooks. So even though it's called Gold Coast Medical Foundation, we do extend our hands into other areas that are possible to, tackle.
I think just I like their philosophy, their grassrootsness of this organization, how it has grown, the genuine care that they give to the clients or the individuals, the patients that they meet with, the way in which they treat their volunteers. They do everything in their powers to have the volunteers, myself included, feel comfortable in being here. Even though, at some point it says this is not a vacation, but it's not just about coming here and, going to do the medical clinics, but also making sure that we have a real experience of the culture of Ghana. So, I've been involved in other organizations, and this place just feels right. It feels egocentric to me. It feels real. It feels like, this is like real work. This is not, and it's not about making money, or that's not what they're about at all. At least that's what I've seen from them so far.
I believe that they do a very good job with combating healthcare, with the problems that people are going through. They make it so that their access to healthcare is free. The only thing that people have to do is just get up and get there in the morning, right? That people get the free health screening, free medication they need, right? And, this is something that I believe the whole global world should need. The only problem is there's not enough people doing it, right? And with organizations like Gold Coast, you're able to get this opportunity for not only...
I know that they are trying to give back to the communities who don't have good health care. And they are trying to do it for free. They don't want to charge anything for it. They just want to do it selflessly.
I think the most important thing is primary care and education, and I think that is what they're trying to do, and they're also trying to partner with other organizations within Ghana to educate and promote health primary care, basically. And I think that is very valuable, because not only are we coming in and doing this, but we're also educating other organizations that are already here doing this, and that improves it as well.
So the healthcare here in Ghana they're really good clinics, really good hospitals. You have to be able to afford a really good clinic, a really good hospital. Also, they're not everywhere. Most of the places that we're hosting these clinics, mobile clinics, are places where they will have to travel miles, tens and hundreds of miles just to get to another clinic. They don't have a clinic nearby. They don't have a hospital anywhere nearby. So what would be great to have clinics, within accessible areas for everyone, which unfortunately is not the case. But if you are, right now, health insurance is free for everyone in Ghana, as long as you have a health insurance card, a national health insurance card, I believe. I'm not too sure how far off of what they pay and how much they pay. However, the healthcare is good if you can afford it. Affordable healthcare is not that easy. And if you're going to clinics where you don't really have money, you're kind of like put on the back burner, which is something we would love to change, something we would love to, do different if we were to be able to build a free clinic, a couple of free clinics, which is accessible by these, towns who have nowhere to go when someone is dying or someone has an emergency. Well, Gold Coast, for one, is very, very focused on this, and we've been very aggressive about it, to the point where we're doing things for donating to clinics and hospitals who are established but don't have the right equipment or tools to function properly. So we've been very aggressive about really changing these kind of situations. Gold Coast, our main mission is a healthier community. And without proper clinics and without proper hospitals in place, you cannot, and without proper outreach to the community, you cannot have a healthier community. And one thing that we really focus on is outreaching through people, whether it's here or in other countries. We travel to other countries, and so far we've done great, to the point where I think the mission and the vision of Gold Coast Medical Foundation is actually pushing through, and we're seeing results where we just donated incubators to a hospital which is seeing a population of over 50,000 people, but only one incubator, and we've donated 2 more to them, so now they have 3. So definitely we're about results, we're about pushing, and if it means paying for things out of pocket, sacrificing time, work time, and sacrificing lots of money out of pocket without sponsors, we get it done. So we're definitely the organization to really push through and help this happen.
I can't really speak too much about, their entire healthcare system, right? Because I haven't really looked at it, but just understanding that we've been here, and there are times that, it's almost a joke, sort of, or kind of jokingly we'll say, okay, so how many people are we going to see today in this village? How many people are expecting? And, one of the organizers will say, oh, maybe about 150. Or maybe 200. And so we get there and we end up seeing 300, at least I think in one clinic, we saw 500 individuals. So I think it's a need, and folks are not just coming because they have nothing else to do with themselves. They're really coming wanting to be checked out, wanting to get the health care, wanting to get, whatever medications. I think just anecdotally, one woman said, and I think there's some things that's not really on the shady side, right? So this one woman said, when I told her that her blood pressure seemed to be fine, she said, that's really something, because a few months ago, some people came and told her that her blood pressure is really high and sold her medication. So, I mean, that was just one story that I heard of, of such things, but I'm sure that sort of stuff happens more frequently than we know of. So folks getting, medicines for stuff that they don't really need.
Well, there are huge disparities, for sure. It's really hard to compare the United States versus any other country in the entire world. I think there's this perception that the United States has everything right when it comes to healthcare, and I'm going to tell you right now that is not true at all. I work in healthcare. I see health disparities on a daily basis. I see patients that have better access to healthcare because they have money, and I see a lot of bias. There are a lot of negative things, like in the United States, that I think people kind of like overlook. But then you come to a place like this, and you see that people don't know anything about what high blood pressure is, ways that they can prevent high blood pressure, and all of this is just, it's education. It's primary care. It's like going out there and, people just talking to others and educating them. And I think that's the number one thing that I would like to promote in this country, and that what is missing. But I wish that we could have, maybe gone to the hospitals and seen what they do for them there, because I really don't know what it's like. We took care of a couple patients at the clinics that they needed to go to the hospital for one thing or another, and they were like, well, I can't afford it, they'll make me pay this much and I can't afford it. And some people were like, oh my gosh, that's crazy. But I was like, you know what, that's exactly how it is in the States though, because, someone will be admitted to the hospital and they'll have $100,000 of hospital debt, and there's nothing they can do. It's the same thing. So I don't really know how that works here, but I think that what can be improved is just primary care and education.
I think that Ghana's health system is very poor. With the places that we have hosted clinics, I would say a good 80 to 90% of people cannot afford medication. There were a lot of times I did a little bit of shadowing, triage and stuff like that. And there were a lot of times where people said that, the reason why I stopped taking my medication is because I can't pay for it, or because I can't go to a hospital. I can't afford, the bills. So I think that it is something that hopefully over time will change. This is still a developing country, but it's definitely a prominent issue.
To be honest with you, I feel like the healthcare system is good, but there's always room for improvement. And in a sense, I'm going to say that because compared to other African countries and compared to a lot of third and second world countries, Ghana actually has a health insurance scheme whereby you see a lot of people that actually come to the clinic have an identification card for their local health clinic. In other words, I feel like there's a lot of public education that needs to go in, because we see that a lot of the clinics that we go to, a lot of the people that come through the clinic have the same kind of diagnosis. Either maybe a high blood pressure, waist pain. I feel like they need to have a lot of public health education in terms of the food they are eating, the environment they find themselves in. So I feel like if we are able to educate the public on all these things, that you don't have to eat meat every day, you can have a balanced diet, you have to eat more fruits, you have to work out a lot, you have to drink a lot of water, I feel like it's going to really help the healthcare system. And also I feel like having a stable clinic, a stable working clinic in a lot of rural areas is going to help the healthcare system go up, and it's going to actually boost the lifespan of a lot of the locals that live here. So there's definitely more room for improvement, but it's definitely not where it used to be.
I've seen that Ghana lacks a lot of medical assistance, and then with this help, or with this foundation, is going to gain enough medical facilities to help improve the health of the citizens.
It makes me very emotional, because you think how something is going to affect you, and you don't really know until you're there, until you're seeing the impact that you have on these people. And for me, I mean, every day that I go to work, I have, the ability to change someone's life, change someone's day. And being here is just it's so different from that, because these people don't have access to this at all. And you realize, like, all the things that you take for granted and all the things that that you have that other people in the world don't have. And it brings you back, and it also makes you realize, like, there's so much work to be done in medicine, in the world, in my country, but with humanity too. I think what I've learned on this trip, it's put me in my place, kind of, and I've learned a lot about myself, and I've learned a lot about other people, and really what it takes. You might think that you're inclusive. You might think that you know everything that there is to know, but you don't. You don't. You haven't walked a day in someone else's shoes, and until you have, you don't understand. So for me, that's really what it did, and just being able to see, these people that have never seen anyone like me, and just the pure love and admiration and respect that they have for people who are different from them. I think it's something that we can all learn from, every single one of us. So that's really what I took from it. Yeah, I learned a lot. I hope that I was able to educate people the way that they educated me in different ways, For sure, I think the hardest thing for me is going to be going back to work, and some people that I have to deal with on a daily basis at work, I'm going to be like, you don't even know how good you have it. I think it's going to be hard for me to kind of be nice with those people, but I'll make it work. I feel like I was talking to people on the trip. There was like a point in my life, like before Africa and after Africa, like I feel like I've learned so much just about life, and I think experiences are so much more valuable to people than anything else. And I'm going to carry this with me in my career, professionally, and personally. I think it's really made me grow as a person. Yeah.
It has affected me in several different ways. Number one, it's made me appreciate what I have. On a day-to-day basis, we take for granted, the littlest things, going to the bathroom and having toilet paper, having a sink to wash your hands, and so on and so forth. And to see people truly appreciative, to have people, pull you aside, or to have people try their best to speak English, to, tell you thank you, or tell you that they appreciate, what you're doing for them. It means a lot. It's something that will stick with you. I definitely think that this is something that I need to go home and sit and reflect and make sure that, like, I remember each and every moment, and I remember the good, the bad, the stressful, the whatever, because at each and every, point in time is a learning experience. Whatever doesn't kill you makes you stronger, so I think that at the end of the day, what I've learned from this trip is going to carry on through generations. I'm going to teach my children, and, whoever asks, I'm going to be like, listen, if you can do one thing, go on a mission trip. Put yourself out of your comfort zone, because it is something that will make a life-changing impact.
This has affected me in a way that it made me realize that there's more to life than just myself and the kind of society that I live in. It's not just about me and about how I'm going to make it, but also thinking about the people, because, 10, 20, 15, 30 years from now, people are not going to be concerned about, what you gave them or where you went to school or what kind of degree you have. They are going to be concerned about how you treated them, how you made them feel. And I feel like being a part of something bigger than myself, because I know me being a part of this great organization has taken me places or has been an impact to many other people as well as it has made an impact to me. So I just feel like me being a part of something bigger than myself is really worth it because I'm contributing to a greater cause. And so, yeah, that's what I have to say to that. Yes, definitely. I think I'm carrying it in the future professionally, personally, everything. I'm going to use it because this experience here has really shaped me, has really shaped my perspective on how I see people, and it has really humbled me in a lot of ways. And overall, it has made me grateful for where I am and where I want to go to. And so, yeah.
Well, professionally, first, to say this, you have to be very organized and very patient to be able to see over 400 patients plus at every clinic. So this experience has definitely taught me lots of organization, patience, how to deal with people who are really in need and, are not sure if you're going to be able to take care of all of them. So they're aggressive, they want to get through, they want to make sure they're seen. It's just really learned how to deal with people who are really in need. Personally, it's just a great feeling, to see someone go through the whole process and get their medication and they're just so satisfied and so happy with just a little bit that we were able to do for them. It's fulfilling to know that we were able to do something for someone with just a little bit that we have. So hopefully in the future we will be able to do much, much, much more, possibly build a free clinic or, get the government and everyone involved to really promote a healthier community and really get the health care out there to the people who really, really need it.
Wow. I think this has been a complete life-changing experience for me. This is the first time that I've ever done anything like this. This is the first time I've been this far away from home. I mean, initially I was born in Jamaica, but I think, and you've seen some of the similarities of Jamaica, I think, in coming here. Just make me appreciate life even more. Make me even more interested in global health. Before, as I was, I think I really focused a lot of my attention on micro level stuff, meaning individuals, couples, that sort of stuff has been my interest. For a long time in my career, I think now, having this experience, I realized that I really have to add to my interest and broaden it more to include the village. The village is entire, an entire community. So yeah, being appreciative, of what I do have, even though I believe that however folks are living here, they're managing, right? They're doing their thing. They're, watching the folks on the side of the road making a living. Folks are not begging. For the most part, right? They're working. You're making a living one way or the other to feed their families or whatever. And it's hard work. So yeah, I think this has got to be one of the best experiences that I think so far I've had in my life.
Coming from the States, I see that, a lot of people get, healthcare, and there's a lot of people that don't. But when you come to a developing country, it's very hard for people to even make it to get to the hospital. So by having outreach programs like this, such as Gold Coast, you're able to, bring the medicine to them. There's so much people that I met that couldn't afford the medication, couldn't even afford to take a trip to the doctor itself. Getting most of the doctors here, if you don't have cash in hand, you're not even gonna get seen. And in America, you think that's absurd, but here, that's just normal life for people. And a lot of people aren't getting their medications. And by having a program like this, you can bring, healthcare to all. By being on this organization, I personally learned how to professionally use a stethoscope, how to listen for heartbeats, how to listen for murmurs, how to listen for if there's anything wrong with your lungs, anything wrong with your stomach with a stethoscope. I learned how to take a blood pressure without having to use the machine. using a stethoscope and just the armband and the pump. I also learned, professional skills. A lot of the people here don't speak English, and there was a real strong language barrier that I had to overcome, and that was a great skill that I thought I did. Going through 11 clinics working with Gold Coast, I was able to, work in a culturally diverse environment while maintaining my professionalism and trying to better the healthcare of the people here.
Well, it's why I got into medicine. It's the whole reason I got into medicine was to eventually have and do, medical outreach like this. I'm here because I want to learn how to do stuff like this. I enjoy helping people in the way that we have by running clinics and, doing school outreaches and stuff like that. But I'm definitely learning and speaking with Kwaku and Kwabena and Maame and everybody that the core group, the people that actually run the show behind the scenes, kind of trying to learn how they organize something like this. So I'll definitely be trying to take this to the next level and, everywhere I go. And just kind of each person I see in a clinic back in the States, I got to remember that, I want to bring that level of care back to somewhere like here and no matter where I'm at.
I think Gold Coast is a very, very plays a huge role in that, in the sense that yes, they are taking care of the people in their local town where they originated from, but they are also taking it to other people who need it, because Ghana is not the only country that is a second and third world country. So I feel like it's very important for them to actually show other countries or other people that, hey, it's fine to go back to your hometown too. It's fine to go back to your country. It's fine to go wherever you came from in order for you to give back, so that their future or the next generations are going to see that there's more for them where they are, instead of going outside of their country to go seek that quality healthcare, that quality education, and that reassuring hope. So I feel like Gold Coast is doing a very, very important and stable job.
I think that I've been asked, along with Dr. Gilchrist, to be one of the board members for Gold Coast Medical Foundation, which I'm really looking forward to. And I'm hoping that this is something that I will do continuously every year. I mean, I think it's become now a part of my plans in making sure that I'm here and helping to do anything that we can do to improve the way that the services provided here and maybe elsewhere. I think folks just really want to be seen and, know that, where it's advertised that here are these people that's going to do free screening. Folks are coming in with some real issues. It's not just, I have nothing else better to do with myself.